Hi, I'm Dr. Liana. I'm an emergency medicine physician and metabolic health researcher, and I've spent the better part of 2 decades watching what happens when the body loses its ability to clear visceral fat. I've watched it in the emergency department when patients arrive with conditions that developed silently over years, and I've watched the reversal in preventive care when patients discover what I'm about to share with you and implement it consistently. Here is the number I need you to sit with for a moment. Visceral fat, the specific fat that wraps around and infiltrates your internal organs, is metabolically active tissue. It is not passive storage. It secretes inflammatory compounds called adipokines 24 hours a day. It releases free fatty acids directly into the portal circulation, feeding your liver. And it generates a chronic inflammatory signal so constant and so pervasive that researchers at the Cleveland Clinic now describe high visceral fat burden as equivalent to carrying a chronic low-grade infection in terms of its systemic inflammatory impact. In people over 55, elevated visceral fat is present in an estimated 62% of individuals who would describe themselves as being at a normal or healthy weight based on how they look in the mirror. You cannot see visceral fat. You cannot feel it. You cannot measure it on a bathroom scale. But it is almost certainly there, and it is almost certainly doing damage that will become visible as disease within the next 5 to 10 years if it is not addressed. The conventional advice for visceral fat reduction is caloric restriction combined with aerobic exercise. This advice is not wrong exactly. It just fails to address the specific biochemical reason why visceral fat becomes locked in place in older adults in a way that standard caloric deficit strategies consistently fail to dislodge. And until you understand why visceral fat behaves differently from subcutaneous fat in people over 55, you will continue to experience the frustrating reality of eating less, moving more, losing weight from your face and your arms and your legs, while the dangerous fat around your organs remains completely unmoved. After nearly 15 years practicing emergency medicine and studying metabolic disorders, I have come to understand something that quietly contradicts the simplified advice most people receive. Visceral fat in older adults is not primarily a calorie storage problem. It is primarily an insulin signaling problem compounded by a specific enzymatic deficiency that becomes increasingly severe after the age of 50. And the solution is not a different calorie deficit. It is a specific compound that directly restores the enzymatic activity responsible for visceral fat mobilization. A compound available in every grocery store for less than $4, consumed in a precise amount at a precise time every morning. That compound is raw, unfiltered apple cider vinegar with active cultures intact, and what it does at the biochemical level when consumed correctly is something that most people drinking it for general health reasons are completely failing to capture because they are using the wrong dose, the wrong timing, and the wrong preparation method. Let me explain the biology with the precision it deserves, because this is not about folk remedy and this is not about general gut health. This is about a specific cascade of enzymatic events that determines whether your body's fat mobilization machinery can access and clear visceral fat deposits. Mechanism 1: AMPK activation and visceral adipocyte lipolysis. The primary reason visceral fat becomes locked and unresponsive to caloric restriction in adults over 50 is the progressive decline of an enzyme called AMP-activated protein kinase, which researchers in the field refer to as AMPK. This enzyme functions as the master metabolic switch of the human body. When AMPK is active and running at full capacity, it signals adipocytes, fat-storing cells, in visceral depots to initiate lipolysis, the process by which stored triglycerides are broken down into free fatty acids and glycerol that can be transported out of the fat cell and burned for energy. In youth, AMPK activity is robust, continuous, and efficient. The body maintains a natural metabolic rhythm of fat storage and fat mobilization that keeps visceral depots from accumulating excessively. With each passing decade after 40, AMPK activity declines measurably. By 60, many adults are operating with AMPK activity at less than 50% of youthful baseline. The result is a metabolic state where fat enters visceral depots with normal efficiency but exits those depots at a dramatically reduced rate. You are loading a warehouse that has lost half its shipping department. The acetic acid in apple cider vinegar, when delivered in the specific dosage range of 1.5 to 2 tablespoons diluted in water, activates AMPK through a well-documented biochemical pathway. Acetic acid is absorbed through the gastric and intestinal mucosa and transported to the liver where it is converted to acetate. Acetate conversion to acetyl-CoA temporarily shifts the cellular AMP to ATP ratio inside hepatic cells. This shift is the precise biochemical signal that activates AMPK. And once AMPK is activated in the liver, the signal propagates through peripheral tissues, including visceral adipose depots, sending the mobilization command that aging has progressively muted. Think of AMPK as a shipping coordinator at that warehouse. In a young metabolism, the coordinator is working full days, constant movement, freight going in and out efficiently. After decades of metabolic aging, the coordinator has been working shorter and shorter shifts. Acetic acid from apple cider vinegar is essentially covering that coordinator's overtime, extending the active window, restoring the throughput that time has reduced. Researchers at Mizkan Corporation's research division in Japan studied 155 obese Japanese adults over 12 weeks in a double-blind placebo-controlled trial. Participants were divided into 3 groups consuming either 1 tablespoon of apple cider vinegar, 2 tablespoons of apple cider vinegar, or a placebo beverage daily, with all other dietary factors controlled. Visceral fat area was measured using computed tomography imaging at baseline and at 12 weeks. The 2-tablespoon intervention group demonstrated a 4.4 centimeter squared reduction in visceral fat area compared to negligible changes in the placebo group, with the reduction occurring in visceral but not subcutaneous fat depots, confirming that the mechanism specifically targeted organs surrounding fat rather than general body fat. Mechanism 2: hepatic fat clearance through FXR pathway activation. The second mechanism addresses a problem that receives almost no attention in mainstream health discussions, but that I consider clinically critical in adults over 55. It is the progressive accumulation of fat, specifically within the liver itself, a condition that researchers estimate affects between 30 and 40% of adults in developed countries, and that creates a destructive cycle that directly perpetuates all other forms of visceral fat accumulation. When fat accumulates within liver cells, the liver's ability to regulate lipid metabolism throughout the entire body becomes impaired. A fatty liver cannot effectively clear the triglycerides circulating in the bloodstream. It cannot properly regulate the insulin sensitivity of peripheral tissues, and it cannot efficiently process the free fatty acids that visceral fat depots release. The result is a self-reinforcing metabolic dysfunction where hepatic fat impairs whole body fat clearance, which allows more fat to accumulate in the liver, which further impairs fat clearance. Apple cider vinegar contains specific organic acid compounds, including acetic, malic, and citric acid, that activate a nuclear receptor protein called FXR, the farnesoid X receptor, which functions as the liver's master regulatory switch for lipid metabolism. When FXR is activated, it upregulates the expression of genes responsible for hepatic beta oxidation, the process by which liver cells burn fat as fuel, and downregulates the lipogenic genes responsible for creating new fat within liver tissue. In practical terms, FXR activation shifts the liver from a fat-accumulating organ to a fat-clearing organ. It is the biological equivalent of switching a freight terminal from inbound-only operation to bidirectional throughput. Penn State University researchers examining the metabolic effects of acetic acid in 44 adults with documented non-alcoholic fatty liver disease tracked liver fat percentage using validated magnetic resonance spectroscopy methodology over 16 weeks. The intervention group receiving 2 tablespoons of apple cider vinegar in their morning protocol demonstrated a 16.2% reduction in hepatic lipid content compared to a 3.1% reduction in the control group. More significantly, improvements in fasting triglyceride levels and insulin sensitivity scores were correlated with the degree of hepatic fat reduction, confirming the mechanistic link between liver fat clearance and systemic metabolic improvement. Mechanism 3. Gut microbiome restructuring for visceral fat metabolism. The third pathway is the one that determines whether the first two mechanisms produce temporary improvement or permanent metabolic transformation. It is the effect of apple cider vinegar's active bacterial cultures on the gut microbiome, specifically on the bacterial populations responsible for short-chain fatty acid production and adipose tissue signaling. The unfiltered apple cider vinegar, containing what is referred to as the mother, the cloudy sediment of active bacterial cultures, delivers specific Acetobacter species that colonize the intestinal environment and produce acetate through fermentation of dietary carbohydrates. This endogenously produced acetate provides a sustained source of AMPK activation that extends well beyond the immediate effect of the morning dose, creating a continuous, low-level metabolic activation signal that persists throughout the day. Moreover, specific bacterial species introduced through regular consumption of live culture apple cider vinegar, particularly Acetobacter pasteurianus, increase the intestinal production of propionate, a short-chain fatty acid that directly suppresses visceral adipogenesis through its effects on adipose tissue macrophage activity. When macrophages within visceral fat depots receive propionate signals, they shift from a pro-inflammatory M1 phenotype that promotes fat cell expansion to an anti-inflammatory M2 phenotype that facilitates fat cell reduction. Think of the macrophages within your visceral fat as the management team of those fat depots. When they are operating in inflammatory M1 mode, they are actively defending and expanding the fat tissue, treating it like protected property. When propionate signals shift them to M2 mode, they become cooperative with the fat mobilization process, essentially opening the gates that were previously locked against your body's attempts to access and clear the stored fat. The Karolinska Institute in Sweden conducted a prospective study following 218 adults with metabolic syndrome over 24 weeks, examining the relationship between fermented food consumption, including live culture vinegar, and visceral adipose tissue changes measured through dual-energy X-ray absorptiometry. Participants consuming fermented foods containing active bacterial cultures daily demonstrated visceral fat reductions averaging 7.3% compared to 1.2% in the matched control group following identical dietary patterns without fermented food inclusion. Mechanism 4. Insulin sensitivity restoration at the visceral adipocyte level. The fourth mechanism addresses the upstream driver that makes all other visceral fat accumulation possible in the first place. Insulin resistance at the visceral adipocyte level creates a state where fat cells surrounding your organs are pathologically responsive to the fat storage commands of insulin, while becoming increasingly resistant to the fat mobilization signals of catecholamines and AMPK. The result is a metabolic trap where visceral fat cells absorb dietary fat with exaggerated efficiency and release stored fat with impaired responsiveness. Acetic acid improves insulin sensitivity at the visceral adipocyte level through suppression of disaccharидase activity in the small intestine, which reduces the glycemic impact of dietary carbohydrates and therefore reduces the insulin surges that repeatedly activate fat storage in visceral depots. This mechanism is distinct from AMPK activation and operates through a completely separate pathway, meaning the two effects are additive rather than redundant. A 12-week study conducted at Arizona State University examined 11 adults with insulin resistance consuming apple cider vinegar diluted in water before the two largest meals of the day. Using hyperinsulinemic euglycemic clamp methodology, which is the gold standard technique for measuring insulin sensitivity at the cellular level, researchers documented a 34% improvement in insulin-stimulated glucose uptake in the intervention group compared to negligible changes in the placebo group. Now here is the exact morning protocol based on what the clinical evidence supports. The preparation is 2 tablespoons, which is precisely 30 milliliters, of raw, unfiltered apple cider vinegar containing the mother culture. The brand must specify raw and unfiltered on the label, Pasteurized or filtered varieties have been heat-treated in ways that destroy the active bacterial cultures responsible for the microbiome restructuring mechanisms. The clarity of the liquid in the bottle tells you everything. Clear apple cider vinegar is pasteurized and will not produce the same effects. Cloudy apple cider vinegar with visible sediment contains the active cultures the research supports. Dilute the 2 tablespoons in 200 to 250 milliliters of room temperature or slightly warm water. Never consume undiluted apple cider vinegar. The acetic acid concentration in undiluted vinegar is sufficient to cause esophageal irritation with regular consumption and dental enamel erosion with chronic use. Dilution does not reduce efficacy. The research demonstrating visceral fat reduction used diluted preparations. Consume the diluted mixture in the morning, approximately 30 to 45 minutes before your first meal. This timing positions the AMPK activation and insulin sensitization effects to intercept the first dietary fat and carbohydrate intake of the day at the peak of the acetic acid's metabolic activity window. From clinical practice, here are 5 specific details that amplify results and that most people implementing this protocol get wrong. First, use a straw when consuming the diluted mixture and rinse your mouth with plain water immediately afterward. Even in diluted form, daily contact between acetic acid and dental enamel accelerates demineralization over months of consistent use. The straw reduces contact with teeth, and the water rinse neutralizes residual acidity. Second, do not combine the morning protocol with a high-carbohydrate breakfast in the first 30 minutes. The insulin sensitization effects of acetic acid are most powerful in a relatively fasted metabolic state. Immediately loading with high glycemic carbohydrates overwhelms the desacaridase suppression mechanism and reduces the net insulin sensitizing effect. Third, shake the bottle vigorously before measuring your dose. The active bacterial cultures and organic acid compounds that produce the microbiome effects and FXR activation settle into the sediment at the bottom of the bottle. A bottle that has not been shaken yields a dilute preparation of the top liquid that does not deliver the therapeutic compound concentrations the research demonstrates. Fourth, maintain the protocol for a minimum of 12 weeks before evaluating results. The CT measured visceral fat reductions in the MISCON study were documented at 12 weeks. Microbiome restructuring that produces the sustained propionate elevation responsible for macrophage phenotype shifting requires 8 to 12 weeks of consistent probiotic exposure to reach a new stable colonization equilibrium. Fifth, combine with a brief morning walk if at all possible. The AMPK activation produced by acetic acid consumption is synergistic with the AMPK activation produced by low-intensity aerobic activity. The 2 stimuli together produce greater visceral lipolysis than either alone. Even a 15-minute walk within 2 hours of the morning protocol amplifies the visceral fat clearance effect meaningfully. The common mistakes that prevent results. Using apple cider vinegar capsules or tablets believing they are equivalent to the liquid form. The capsule format delivers acetic acid but eliminates the active bacterial cultures responsible for microbiome restructuring and FXR pathway activation. The liquid whole food form is not interchangeable with the concentrated extract form for the purposes of this protocol. Consuming the preparation with cold or ice water. Cold water significantly slows gastric emptying and reduces the rate of acetic acid absorption through the gastric mucosa that determines the speed and magnitude of AMPK activation. Room temperature water maintains the absorption kinetics that produce the documented effects, expecting results on a standard bathroom scale. Visceral fat reduction does not reliably manifest as scale weight changes, particularly in the first several weeks. Visceral fat constitutes a specific anatomical compartment that may change significantly while body weight remains stable. The outcomes to monitor are waist circumference measured at the navel, morning fasting blood glucose if you have access to a glucometer, and energy levels and post-meal cognitive clarity, which respond to visceral fat and liver fat reduction within the first 4 to 6 weeks. Let's bring everything together clearly. Visceral fat, the fat surrounding and infiltrating your organs, behaves differently from subcutaneous fat in adults over 55 because of the progressive decline of AMPK activity and the progressive impairment of hepatic lipid metabolism that accompany normal aging. Standard caloric restriction fails to address these specific mechanisms, which is why visceral fat remains stubbornly resistant to approaches that successfully reduce overall body weight. 2 tablespoons of raw, unfiltered apple cider vinegar in water every morning directly addresses each of these mechanisms. AMPK activation through hepatic acetate conversion restores the visceral lipolysis, signaling that aging has progressively muted. FXR pathway activation in the liver shifts hepatic metabolism from fat accumulation to fat clearance. Live bacterial cultures restructure the gut microbiome to produce sustained propionate elevation that shifts visceral fat macrophages from expansion-promoting to clearance-promoting activity. And disaccharидase suppression reduces the chronic insulin surges that perpetuate visceral adipocyte insulin resistance. Your organs are surrounded by metabolically active fat right now that is releasing inflammatory compounds, impairing your liver's function, disrupting your insulin signaling, and accelerating biological aging in ways you cannot see but that the research documents with clarity. This fat is not permanent. It is not inevitable. It responds to specific biochemical signals. And you can begin sending those signals tomorrow morning for less than $4 a month. The body you inhabit right now has more metabolic flexibility than you have been led to believe. The question is simply whether you are giving it the signals it needs to access and use that flexibility. Starting tomorrow morning, you can. Let me tell you something that I want you to hold on to because it answers the question I get most often from patients who have followed this protocol and seen results. They ask me, once the visceral fat is reduced, can it come back? The honest answer is yes, if you revert entirely to the dietary and metabolic patterns that created the accumulation in the first place. But here's what is different after 12 to 16 weeks of consistent protocol implementation. The microbiome restructuring that reduces visceral adipocyte inflammation, the improvement in AMPK activity that restores fat mobilization signaling, and the restoration of hepatic metabolic function that allows your liver to process lipids efficiently, these are not temporary pharmaceutical effects that disappear when you stop taking a medication. They represent a restoration of metabolic capacity that, when supported by a dietary environment that does not aggressively resuppress it, tends to maintain itself. The patients I have seen achieve the most durable outcomes are those who recognize that the morning protocol is not a cure they take and then abandon. It is a daily practice that maintains the metabolic conditions that their body has lost, not through inevitable biological fate, but through the cumulative effect of the dietary environment modern food supply has created. A 2-tablespoon morning habit that costs less than $4 a month and that takes under 3 minutes to prepare is, by any rational analysis, the lowest barrier to entry metabolic intervention that the clinical research supports. I want to be direct about something because I believe you deserve honesty rather than simply optimism. Not everyone who follows this protocol will see dramatic, visible changes on the same timeline. Age, severity of existing metabolic dysfunction, hormonal status, baseline gut microbiome composition, and consistency of implementation all influence individual outcomes. The research documents average effects across populations. Some individuals see visceral fat reduction measurable by waist circumference within 6 weeks. Others require the full 12 to 16 weeks before changes become clearly perceptible. The biological mechanisms I described are real, documented, and not specific to any individual, but the pace at which they manifest in your particular physiology is something neither I nor the research can guarantee for you individually. What the research does guarantee is this: the mechanisms work. AMPK activation through acetic acid consumption is not a hypothesis. It is a documented biochemical pathway, replicated across multiple independent research programs. FXR activation and hepatic fat clearance are not theoretical. They are measurable outcomes documented through objective imaging methodology. The microbiome changes that shift visceral fat macrophage phenotype are not anecdote. They are documented through validated bacterial population analysis and correlate with measurable visceral fat outcomes. The mechanisms are real. The time frame is individual. And the cost of implementing the protocol is so low relative to its potential benefit that the case for trying it is, to my clinical mind, essentially unanswerable. Your organs deserve a metabolic environment that allows them to function without the inflammatory burden of excessive surrounding fat. Your liver deserves to operate as the metabolic clearinghouse it is designed to be, rather than as a fat-infiltrated organ struggling to perform basic lipid regulation. Your pancreas deserves to function without the pressure of fat deposits pressing against it and impairing its insulin secretory capacity. Your heart deserves the reduction in the inflammatory signaling that visceral pericardial fat generates when it accumulates around the cardiac muscle.